All right. Hello, everybody. Thank you so much for joining us today. We have Ariel from CARI, which is Center for Advocacy for the Rights of and Interests of Elders. They are the Pennsylvania SMP. I'm going to turn it over to him for introductions and to get started with the presentation.
Okay. Well, thank you, Nina, for inviting me to talk. We have just become members of the ASC. And so we're very excited to meet you folks and to be able to share what we can do and how we can help your consumers and constituents. So my name is Ariel Rabinovic, and I am with the Pennsylvania Senior Medicare Patrol, which is a program that's administered by CARI in the state of Pennsylvania. So in today's presentation, what I'm going to talk to you about is Medicare fraud. And specifically, what we're going to talk about is what Medicare fraud is, the effects of Medicare fraud. We're also going to talk a little bit about some of the scams that we're currently seeing in the state of Pennsylvania. And most importantly, we're going to talk about what folks can do to prevent, detect, and report Medicare fraud. And what the hope is here is that that you can share this information with the folks who reside in your facilities, in your residences, so that they can protect themselves. So I just want to start a little, I just want to start a little bit by telling you about CARI. So CARI stands for the Center for Advocacy for the Rights and Interests of Elders. We are a nonprofit organization which works to improve the quality of life for older adults. We've been working in Philadelphia since 1977, and our mission is to promote the well-being, rights, and autonomy of older adults through advocacy, education, and action. So even though we are located in Philadelphia, we have a number of programs. Some of our programs are Philadelphia specific. So for example, we are ombudsmen. So we are ombudsmen for Philadelphia and Montgomery County now. But we also have programs such as the Senior Medicare Patrol, which extend and cover the entire state of Pennsylvania. So let's talk a little bit about Medicare fraud, errors, and abuse. And I wanted to start out by saying that many people think that on the beneficiary side that, you know, it doesn't really affect me because I'm not paying for it. Actually, it's important to notice, to keep in mind that Medicare fraud affects everyone. Medicare is the third largest public program in the United States. And even though we're not exactly sure, economists and government experts estimate that between 60 and $90 billion, that's with a B, of taxpayer dollars are lost to improper claims, to fraud, waste, and abuse in the Medicare program. And the direct effects for all of us is that it puts the Medicare Trust Fund at risk for the future. So that should be something that we should all be worried about. Now, on the beneficiary sides, the results, the Medicare fraud, waste, and abuse results in higher premiums, loss of money for needed benefits, and decreased quality of care. So let's talk a little bit about these points. So when we think about the consequences of Medicare fraud, errors, and abuse, we think about three things: medical identity theft, health impact, and the personal financial losses. So medical identity theft is when someone's Medicare number is compromised, either by a provider, a scammer, or somebody else who gets their hands on that information. And what that allows that individual to do is to then use that number to access benefits and to defraud the Medicare system. Now, a few years ago, Medicare moved away from using folks' social security numbers in favor of using what's called a unique identifier, unique ID. And that's been really, really helpful for consumers, because if someone's Medicare number is not compromised, what they can do is they can call Medicare and request a new number. Once that new number is put into use, the old number becomes obsolete and can no longer be used as a valid insurance number. And that's been really helpful for folks to, protect themselves in case their medical identity has been compromised. One of the things that I do find still, though, is that people don't know they can do that. They still think that this is a number that they can, that they're stuck with, or they don't know how to go about asking for a new number. Then let's talk about the health impact. So from the health perspective, the immediate result is that when someone is a victim of medical fraud, Medicare fraud, they often can end up receiving treatments that are not appropriate for them. And at worst, they can actually be harmful. So for example, there was a horrendous case back in 2014 where a Detroit area oncologist was giving chemotherapeutic treatments to patients who did not have cancer. And that was done so that they could collect the higher payments that went along with those treatments. As a result of that, there were many people who suffered long-term disabilities because of being exposed to these treatments. So that's a particularly egregious case of someone receiving a medical treatment that they did not need, that actually ended up really harming their health. However, we don't have to go that far in order to see effects. So many, because if somebody is a victim of Medicare fraud, it is possible that their future healthcare can be affected, because their medical record might now contain information that might not be correct. So for example, they could contain incorrect lab results or incorrect diagnoses or allergies or things like that. And so that could really affect their treatment going forward. Also, many of the services that you get through Medicare, that folks get through Medicare, are dependent upon, they have a time limit. So for example, certain pieces of durable medical equipment can only be purchased every 5 years. So if one of these services is purchased fraudulently, when the individual really needs that service, Medicare might deny it because they might say, you've already gotten that service, we won't pay for this one. I've seen many of these cases. We can resolve that, but it usually, you're dealing with a big program. And so it's really, really difficult for consumers on their own sometimes to know how to go about resolving these things. And then let's just discuss briefly personal financial losses. So when somebody is a victim of fraud, oftentimes they might get stuck with copays or payments that they might not be able to afford because Medicare would deny the treatment. This is really a problem, for example, for folks also who are underinsured. So people who do not have a secondary insurance program end up getting stuck with the cost of the 20% for an unnecessary procedure. So what is the Senior Medicare Patrol? The Senior Medicare Patrol is a program that was started back in the 90s. And the main goal of the Senior Medicare Patrol is to help Medicare beneficiaries prevent, detect, and report healthcare fraud. And in doing so, what we're doing is we're helping to preserve the integrity of the Medicare program. This program was initially started and still is a peer-to-peer education program. So it was originally conceived as a program where Medicare beneficiaries would be trained to educate other Medicare beneficiaries in how to prevent, detect, and report Medicare fraud. So currently, the program relies on about 5,000 volunteers throughout the country to help deliver this outreach. And it's something probably failed to tell you, is that SMP is started out as a pilot program and is now in every state and territory in the country. So let's go a little bit to the next slide. So the Senior Medicare Patrol's mission is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. And we do this through outreach, counseling, and education. So here in Pennsylvania, we have volunteers who can visit counties. We have 67 counties throughout the state and give presentations to at senior centers or any place where seniors gather to educate them about what Medicare fraud is and how to prevent, detect, and report it. We also have counselors, and I'm the primary counselor here in the state of Pennsylvania, who handle all the complaints. So we also have, and what I do is I help people collect information and work with our partners in law enforcement to resolve these issues. So I wanted to draw your attention briefly to this QR code. Can everybody see my arrow that I'm using here, my pointer? I'm
Yes.
assuming, yes, okay, great. So this QR code, if you hold up your phone to it, will take you to our website. And on this website, there's various links. There's news, there's events, there's some information about our program, but also there are links to where a consumer can go ahead and make a report if they suspect fraud. It's also, folks can also, there's a link to request speakers or information. And I wanted to also mention that everything that we do, all the services that we offer are free to the public, and all the information when we talk with consumers are confidential. So let's talk about what Medicare fraud is. Medicare fraud fundamentally is all about intentionality. So it is where an individual intentionally bills Medicare for services that were not received, or they're billing for a service at a higher rate than is actually justified. So it's all about intention. It's the deliberate conception of a scam and implementation of a scam to defraud the Medicare program. And there's also Medicare abuse. And there's often a fine line between the two. To tell you the truth, I don't really worry about it too much, because for all intents and purposes, they're pretty much the same. It's a distinction that's really important to law enforcement when they go ahead and prosecute these crimes. So this is where providers supply services or products that are not medically necessary or do not meet professional standards. And then there's also errors, and that is actually something that's quite common. There's often mistakes made in coding or when somebody bills for a service. And usually those are very easily being able to be resolved. So that's another thing too. And a lot of it is just mistakes. This is a complicated program. So here are some examples of fraud and abuse. Billing for services, supplies, or equipment that were not provided. Billing for excessive medical supplies. Obtaining or giving a Medicare number for free services. Improper coding to obtain a higher payment, unneeded or excessive x-rays and lab tests, claims for services that were not medically necessary. So for example, that would be the situation that I talked to you about and with that oncologist in Detroit, or using another person's Medicare number, or letting somebody else use your Medicare number in exchange for a kickback, for example. All those are examples of fraud and abuse. So some common scams that we're now seeing in Pennsylvania, the two main ones that we are seeing are the genetic testing scam and the durable medical equipment fraud. So in the genetic testing scam, scammers are offering consumers a cheek swab, for example, in order to, in exchange for their Medicare number. And the offer is that they be able to predict their person's risk for developing cancer or cardiac disease. However, what it is, it's an elaborate ploy to obtain the Medicare number. What happens is the sample usually is sent to a laboratory, sometimes it's not, and the laboratory then bills Medicare for the test. And the test can run several $1,000s, thousands of dollars. And then the lab then usually gives a kickback to the marketers. Now, there are lots of genetic testing tests out there, and they're perfectly reasonable. However, Medicare is very, very specific about how you can legally use this. So they have to be done in consultation with a personal physician, and they have to be done as part of an ongoing diagnosis. So, for example, if you have been diagnosed with cancer, for example, they have to be done and requested by your personal oncologist. What happens in these scams usually is there is a Medicare, there's a doctor that is usually cut into the scam through a telehealth company who will sign off on the tests. Now, on the DME fraud, it's pretty much the same thing, except that here we're talking about durable medical equipment. So people getting calls and offers for wrist braces, back braces, you name it, braces. And it's pretty much the same thing. Telemarketers call Medicare beneficiaries and tell them that Medicare has this wonderful free device for them, and they get a doctor to sign off on the order. The order is sent to a durable medical equipment company who delivers the product and then cuts in and gets paid by Medicare and cuts in the telemarketers for a kickback. These two scams have been aggressively pursued by law enforcement. So in 2019, both of these scams were targeted. In the case of the genetic testing scam, there was it's called Operation Double Helix. In the DME fraud, it's called Operation Brace Yourself, very creative names. And they were able to go after dozens of fraudsters and bust up these rings that were, billion-dollar rings. I think in a genetic testing scam, they've collected well over $2 billion in judgments in these cases. And these are ongoing cases. Unfortunately, I can tell you that these scams are not going away. The genetic testing scam is extremely profitable. So we constantly see this one. Another scam that people should be aware about is what we call the new Medicare card scam. People get a call and saying, there's a new Medicare card going out, and it can be presented in various ways. New Medicare card, a plastic card with a chip in it, and we just need to verify your Medicare number, and then we'll send you your new card. There is no new Medicare card. The Medicare card that people have, the little paper card, that's it. So that's another very common scam. And the basis of all these scams is to collect that Medicare number. That Medicare number is the key to defrauding the Medicare system. So keep those in mind. And we always want to hear, if you hear about these, if folks in your communities are affected by these scams, we definitely want to hear about them. We collect information for the Office of the Inspector General, the Department of Health and Human Services, that track all these scams. And we can also assist beneficiaries in repairing their benefit if it's been damaged by scams. And another thing I wanted to touch base on is that as you all know, we're in the middle of open enrollment until December 7th. And around this time, we see quite a bit of aggressive marketing fraud by insurance brokers and agents. And CMS, the Center for Medicare and Medicaid Services, has very strict guidelines about what agents and brokers can and cannot do. And I've sent Nina a larger document that outlines what these guidelines are. So I encourage you to become familiar with them, or at least to post them in a visible area so that people can see and be on guard. So importantly, agents and brokers cannot make unsolicited calls to beneficiaries trying to sell them insurance. They cannot send unsolicited mail to beneficiaries. The only time they can contact beneficiaries is if they have a prior relationship. So if, for example, I have an Aetna plan, Aetna brokers can contact me to let me know about other services they might offer. They can't provide meals at marketing events. They can provide snacks, drinks, that kind of things, but not a full meal. They cannot claim to be endorsed by Medicare, and they cannot claim to be from Medicare. They can't sell Medicare plans door to door or cross-sell insurance products. These last two is something that we actually see quite often. Somebody, a broker will make an appointment with somebody who lives in an over 55 community, for example, and that's perfectly fine. They made an appointment, they're going to talk about, but then they go and knock on other people's door and try to sell them insurance. And once they're there to sell them a healthcare product, they then turn around and try to sell a life insurance policy. All those things are strictly prohibited. So what can people do to prevent Medicare fraud? Actually, there's quite a lot. And the main mission of the Senior Medicare Patrol is to teach folks how to detect, and report Medicare fraud. So let's talk about each of those steps. So folks can protect themselves by doing fairly simple things. We encourage people to treat their Medicare card and number like it's a credit card. You don't show your credit card to just about anybody. Do the same thing with your Medicare card and number. Be mindful of identity theft. We also encourage people to know that Medicare doesn't call or visit to sell you anything. Not only sell you, but to really tell you anything. So if Medicare wants to get in touch with you, they send you a letter. If somebody gets a call and they say, we're from Medicare, that's the big red flag. Medicare doesn't call you, neither does the IRS or Social Security. The same thing goes there. And we also urge people to be very cautious about free medical services. Nothing is free, and it's also true in Medicare. Somebody ends up paying for this. The offer of free is usually in exchange for something, and that something is the person's Medicare number. So for example, we've seen many cases of a health vendor showing up at an event and saying, here's a free examination or a free consultation for whatever, and just write your name and your Medicare number down, and then we'll give you that. That's not legal. They can't do that. Or we've seen it in the case of insurance agents who will have an event, and at the event they ask for people's Medicare number. They can't do that. So don't give out your Medicare number except to your doctor or other Medicare provider. And I really encourage this. That Medicare number should be between you and your doctor. Nobody else needs to know that. And also don't carry, we always tell people, do not carry your Medicare card unless you need it. And when you're going to see a doctor, the only time you need it is that first visit when you have to give them the Medicare so they can bill properly. After that, there's no reason to carry it around. So let's say that you've been careful, but fraud still happens, and unfortunately it does due to various reasons. So for example, we've seen numerous instances of data breaches where people's information is compromised. So what can folks do if they have been victimized by Medicare fraud? How would they find out? We encourage people to use two very important tools. One is the personal healthcare journal, and another one is the Medicare summary notice. So the personal healthcare journal is just a diary. And I like to think of these as your, when you deal with a bank, your checkbook, if anybody still uses those. What people do is when they go, we encourage people to document whenever they go to a doctor, whenever they receive a piece of equipment or a service through Medicare, to write that down. Write down the date, write down what was done to the best of your ability. And then when people receive the Medicare summary of what Medicare benefits they've had, they can compare the two. And so when anybody uses the benefit, every 3 months, they will receive a Medicare summary notice. If they're on a Medicare not assistance program, Advantage plan, they will receive an explanation of benefits. What people want to do is compare the two. And in particular, they want to look out for services that they didn't receive. So if they see a provider name they don't recognize, or a piece of equipment that they didn't receive, that's a red flag. They also want to look out for instances of double billing. Frequently, these are errors, things get billed incorrectly, or services that are not ordered by your doctor. In addition, I want to draw your attention to, people who don't want to wait the 3 months to get this Medicare summary notice can go to mymedicare.gov and register and create an account there, and they're able to see how their benefit is being used in real time. So they go to the doctor, they can check the next day and see, they can see as it's updated in real time. So what can people do? This is the report part of the strategy. What do people do if they suspect they've been a victim of fraud? The first thing we do is to tell them to call the provider. Oftentimes, that's going to clear up if there's an error. And also, there's many services that people get, well, not many, but there's some services that people get that you really never meet the provider. So for example, if you go in for a biopsy, that biopsy will be sent to some lab somewhere, often out of state. And so when people get the bill or they see the Medicare summary notice, they said, I don't recognize this at all. What is this? It's not fraud. It's just, you've never seen them face to face. So for example, the anesthesiologist oftentimes will submit a bill. Many people don't remember seeing their anesthesiologist during the procedure, for good reason. So what we encourage you is to call the provider and also to gather any information like your Medicare summary notices, documentation. So for example, if you've received the bill, if people have received a bill for a service, please retain that. And finally, if a call to the provider did not resolve the issue, if there's still questions, if people are still unsure, we encourage them to call us. And this is our direct number, 1-800-356-3606, or you can visit us at this web address. That's the address that's accessed with this QR code, and you can submit a report or complaint of fraud. So once again, you can contact here. You can contact us through these methods. You can contact us not only to report suspected fraud and abuse, but you can contact us if you want training, if you want speakers to visit your facility, if you want materials, we can send you out. For example, I provided Nina with some documents. One document is our Protect, Detect, and Report, which briefly talks about fraud, what it is, how to recognize it, and what to do about it. We also have a Need Help, Get Help flyer, which gives people information about who to call in case there's fraud that happens. And finally, we have copies of the Personal Healthcare Journal that people can use. So we are able to send out all this material. In addition, we release periodic materials. For example, if there's a particular scam that's going on, we release what's called scam alerts that we like to share with everybody. So things to be on the lookout for. And also, we're always looking for volunteers. So folks who are interested in helping their community and educating their community. And it doesn't only have to be through public speaking. Many people don't want to public speak. It could be as a contact or a point of reference. So for example, somebody who's in a residence might agree to distribute material when it needs to be. So that's also something that, you know, is very helpful to us. So that's all I have for now. So if you guys have any questions, I'd be more than happy to try to answer them.
Thank you, Ariel. I was going to say, I am sending out the information that was referenced in the presentation today. It will go out at 4 along with the link to the recording. So you guys will have access to those resources to download and provide to residents if needed, or post on a bulletin board, whatever sort of works for you all. Do you guys have any questions? See, I'm not seeing, you can unmute yourselves if you have questions, or you can chat them in. Either one is an option.
I'll stop sharing my screen.
Okay.
I'm not seeing anything in the chat, so.
Either, and I don't see anyone that has unmuted themselves. So I'm assuming there's probably no questions at the moment, but if y'all think of them, my email is linked in the information I'm sending out as well. So you can always shoot a question over to me, and then I can get it to Ariel for follow-up.
Okay, well, thank you very much for your attention. I really appreciate you having me here. And once again, if you have any questions, or you have folks that, you know, may be experiencing fraud or have questions, they're always free to call us. Everything we do is free and confidential.
Thank you so much for your time. I appreciate it.
Of course.
Thank you.
Take care.
Thank you for the information.
You're welcome.